right, I think we will go ahead and get started now. Thank you all so much for joining us. My name is Chelsea Kimura. I'm a training and technical specialist with the Northwest ATTC, and I'm here to support the session today. We have just a couple of housekeeping items to kind of go through. So the session is being recorded today, and it will be available on our website in a couple of weeks for you to review and to share with others. If you have any questions throughout the session, please do feel free to reach out to me. Or you can include questions you have for Sara in the chat, and I will get those over to her. You're also welcome to come on mic and share any questions that you have as we go through the session. All right, and I would like to open our session in a good way by sharing our land acknowledgement with you all. Can we go to the next slide, please? Perfect. Our work intends to reach the addiction workforce in HHS Region 10. This includes Alaska, Idaho, Oregon, and Washington. This region rests on the ancestral homelands of the indigenous people who have lived on these lands since time immemorial. Please join us in support of efforts to affirm tribal sovereignty and in displaying respect and gratitude for our indigenous neighbors. All right. Thank you, Dolores. It's good to see you here. All right, thank you, Sara. So Sara Biegelsen is a licensed acupuncturist, a clinic manager, partnership coordinator, and certified 5NP technician trainer at Working Class Acupuncture, a community acupuncture clinic in Portland, Oregon. She also works on faculty at the only accredited acupuncture school for licensing the next generation of community acupuncturists. And with that, I'm going to go ahead and hand it over to Sara. Thank you for being here with us, Sara.
Thank you so much, Chelsea, for having us. Hi, everyone. I'm Sara, and there is a pre-survey and a post-survey. So if you can go ahead and use that QR code now to do the pre-survey, and we'll see a different QR code at the end. I'll give you all a little bit of time to click that. All right. If anybody had trouble finding that, Chelsea probably can help. So welcome. Thank you for choosing to spend an hour of your day with us to talk about the 5 needle protocol. The goal of this presentation is to talk about its history in the States and the possible future of it in your workplace. So to begin, I just wanted to explain a little further who we are. I'm Sara. I am representing Working Class Acupuncture today. And so we're a 501(c)(3) in the greater Portland area. Working Class Acupuncture is a small but mighty set of 4 community acupuncture clinics, and we have partnerships with several outside organizations, meaning we have a couple offsite clinics, and then we just go out and create pop-up clinics as well. Our main partnership, though, is with POCA Technical Institute, which is the only accredited acupuncture school training up the next generation of community acupuncturists. And I myself went there. So we were asked here because great efforts were made by students of Pocatech along with members of WCA. We worked with the NIA Action Fund to spearhead a community-led movement to get a House bill passed in Oregon, allowing for people to become certified and registered to offer the 5NP, 5 needle protocol here in Oregon. I know some of you are in Washington, Idaho, Alaska. So hopefully, if you're not living and working in Oregon, hopefully this will kind of orient you to how you could perhaps get something like this going in your state. So the project began as a student capstone and was taken on by many community members throughout the state and beyond. So what is 5NP? I would imagine lots of you on this call today know what 5MP is and perhaps even practice. But for those of you who don't, the 5 needle protocol is a safe, effective set of points that address behavioral health issues, including addiction, mental health, disaster, and emotional trauma. The 5 points placed in the outer ear relieve symptoms of substance use disorder, withdrawals, and underlying emotions that are deeply connected to these symptoms. 5NP can also be great for PTSD, stress, and a myriad of other conditions that people manage daily. And this image right below showing the ear, those blobs. Those are the sites where you would be putting needles or stickers with little pressure beads. Why 5NP? 5NP is an easy to learn and teach, accessible and barrier-free treatment that can address a wide range of symptoms. The success of 5NP demonstrates that healing and recovery happen together. We believe everyone should have access to this trauma-informed, community-centered treatment and that it is best received by fellow community members. Just a little side note here, we were connected to Chelsea via an Oregon Health Authority pop-up that we did. We sent a bunch of our interns down to Salem when the community health worker conference was happening. And we were like, we had gone last year and did standard community acupuncture, but this year we knew 5NP was coming on the rise, and we wanted everybody that was there to see and feel the effects of this because we wanted them to be able to imagine themselves being able to share this with their communities. So where does 5NP come from? 5NP was originally developed to treat addiction in the 1970s. Research has shown that it can also be applied to effectively treat a wide range of behavioral health concerns. In the late 60s and early 70s, methadone was taking over. The Lincoln Hospital, also then known as the Butcher Shop, was the epicenter for a community-led take-back of health and wellness. Black and brown revolutionaries took over the hospital that was failing to serve these communities and started up the Lincoln Detox Program. Through learning about the success of acupressure and acupuncture on regions of the outer ear to help with withdrawal symptoms, these community leaders tinkered until they found the set protocol we now know today as 5NP. By witnessing these great results in their communities, so began the 5NP movement. So that's a lot of information in one slide, but pretty much what 5MP is a really elegant and simple set of points that you can either use puncture or pressure to alleviate so much of what so many people live with from day to day. It's this amazing tool that can help manage and maintain health and wellness. And it was brought about because people were falling through the cracks, and the government was very much not taking the path forward that was going to support people in wellness. And so that is at the core of what 5MP is. People were doing this at a time when the practice of acupuncture itself wasn't even a profession in the States yet. So this predates acupuncture in the United States even as a profession. So how did it inspire community acupuncture? The Lincoln Hospital takeover and its transformation from a space intended for health but missing the mark into a space of true community health can be likened to liberation theology. The needs of the poor and vulnerable should be given priority when creating social policies, thus creating commitment to care for the most marginalized in efforts to be a more just and equitable society. Community acupuncture took the teachings of liberation theology, blended it with the liberation praxis of the Lincoln takeover, and created high volume, low cost treatment spaces. So that is the type of acupuncture system I practice within, and that the school that was so heavily involved in the creation and passing of the House bill here in Oregon, this is our history that we came from. And so who has already been using 5NP in Oregon before the House bill? 5NP has been practiced by community members on tribal lands in Oregon for many years, but most Native Americans don't live on tribal lands. The NAYA Action Fund was such a champion for this House bill because as community members already accessing 5NP, they knew it would be beneficial to create a way for people living through the entire state to be able to access the health benefits of this harm reduction practice. This bill, hands down, would not have passed if we didn't have NAYA Action Fund championing all of it. Will Miller was working for NA Action Fund at the time, and is just such an amazing and inspired individual. I interviewed everyone involved in the process along the way, and we're going to have a short video eventually available, hopefully before March, that I can share out to everyone. It's free. It'll probably be on our website too. But in his interview, he even said, in other states, just if you can't find someone like me, reach out to me and hopefully I can connect you to someone like me. And that's a genuine offer. So if at any point in our Q&A anybody wants to talk more about this, I would love to talk more. And so how can 5MP benefit your workspace? I was able to look a little bit beforehand at what different types of workspaces people who signed up might be in, and this holds true for everyone. 5NP is great for trust building, buy-in, community, polyvagal responses, and the expected benefits of a 5MP treatment. So, depending on what space you are working in, the beauty of 5NP is that everyone comes together and can find themselves seated in a circle or just in a room near one another. And participants in whatever program you work in and yourself or fellow coworkers can all be receiving treatment side by side. So it's great also in that way, not only just trust building, but for buy-in. If a participant who trusts you sees that you're receiving a treatment, they'll be like, okay, maybe I'll give that a try. Whereas before they might have been skeptical. It also helps build community because inherently it's a community practice. Folks typically receiving 5NP are in a room with other individuals receiving 5NP. And at some of our offsite clinics, we predominantly are just offering 5NP, and people are so excited when the door's unlocked and the lights are on that day. They know it's an acupuncture day, and they come in for as short or as long as they have available for themselves. And they hop in a chair, and the room takes care of itself. When a newcomer comes in, it's not necessarily the person applying the needles who explains how it goes. Everybody knows how it goes. And it's just this container that's so beautifully created by everyone who's in it. Which, brings us to polyvagal as well. The whole idea that when one is creating a sense of calm, it can be felt by others in that space. And so just that whole ripple effect of even the minute you walk in, you might have been shouting when you were on one side of the doorway, but once you come in, you start already feeling the effects of that treatment in that space. And the expected benefits of a 5MP treatment, I was doing a practice run training, and so somebody put the points in, and I'm, animated and this and that. And just the minute the needles went in, I was having a hard time still being in the room, still presenting, just because it has that lovely and strong an effect, at least on me. And I do believe on many people. But it was funny because the feedback from everyone was exactly that. They're like, wow, you haven't raised your arms up in a while. And so the benefits are best understood through being felt, which brings us all the way back up to trust building. Whereas if you haven't experienced 5NP before, I hope that you can find a place near you where you can, because the easiest way to explain it is when it's felt. All right. So how did the House bill in Oregon get created? Community networking and engagement were both key to creating the legislation for access to 5NP. People researched what routes other states had taken. They asked what they would do differently in hindsight and began the process of relationship building between multiple organizations within the state that could be positively affected by the existence of the House bill. This is so crucial and key. And when we go to Q&A, if you're not in Oregon and you want to ask more about this, definitely take this time to do it. I'd also love if people are or are not in Oregon, if in the chat if you're feeling inspired, go ahead and like say what state you're in and list your contact info so that if there isn't a lot of activity in the Q&A, you can at least see, oh, hey, there's somebody else in my state who wants to continue this conversation. Because you gotta build your core team of people who really want to see this happen. And from there, you're going to find the people who you need to along the way. Like if you can find a lobbyist like Will Miller, or if you want to talk to Will and Will help you find someone in your area, finding that state rep who would be willing to champion the bill and present it to their group. Um, you know, I don't want to talk too much about it in case people aren't interested in this part, but again, there will be this video that I have all the material for, and now I just need to condense down that will be available sooner than later. Okay, so if you're in Oregon, what's the process of becoming a 5MP technician? Probably lots of people are like, yeah, come on, this is why we're here. So, this morning at 11:06 a.m., the Oregon Medical Board officially voted unanimously in approval of the current rules and regulations that they had been working on in a very transparent and community-based process. And so the next steps for the Oregon Medical Board are to complete their IT build out of how people can register. So we are on track for March 2026. So this March, the Oregon Medical Board will begin enrolling 5NP technicians in their registry. To qualify for this, one needs to attend a 2-day training with lots of hands-on learning in 5NP along with its history. I call it a 2-day training because the amount of hours required for this training happen over the course of 2 days. Some people, though, do it over the course of 5. Trainings are different based on who and how offer them, but they all have a core set of information required by the Oregon Medical Board's rules and regulations and by the history base of how we learn 5NP. Once you've completed a training and received your POCA or NADA certification, you can then pay the $100 fee to the OMB and apply to be in their 2-year registry. So that's a big old bowl of alphabet soup, but basically, if you want to do this, you are going to sign up for a training. And the training, somewhere in the languaging, you're going to want to know that it is either POCA or NADA approved, created, certified. POCA is People's Organization of Community Acupuncture, and NADA is the National Acu Detox Association. I say that with a question mark in my voice because I think it's right. um, these are the two organizations that already exist, that already offer trainings. And what the Oregon Medical Board wrote into their rules and regulations brilliantly, I think, was that within 2 years, if you have been a certified 5NP tech through Oregon, you yourself ought to be well versed enough to offer a POCA or NADA equivalent training as well. It's all very complicated when it's stuck in all these letters, but the main idea is if for whatever reason POCA or NADA were to fall away, Oregon has something in place that still holds true that if you can do a training that is equivalent to what we've already approved of, this still exists. So I thought it was really cool that they built out languaging that allowed for life to change as it does. um, there is a $100 fee to the OMB, which is the Oregon Medical Board. That covers your 2 years of registry. So it's a 2-year or it holds for 2 years. And so it's essentially $50 a year, but you pay the 100 up front. And once you're registered, you're good to go. Oh, something important to know about registration with the Oregon Medical Board is the Oregon Medical Board requires a background check for everyone. It's just part of their process. And in the rules making time period, a lot of us in the community were trying to find out, does this have to happen, with the basis of this being community led and for the community by the community? That could really be something that would make someone perhaps feel less inclined to want to pursue this. And the Oregon Medical Board, that's just something that they have to do as who they are. But they assured us that background checks are not a deal breaker. It's just simply a step in the process that if you did have something that came up, that it could be as simple as perhaps your 5MP trainer writing a letter of support saying, oh, I totally think this person's great to do this. And so as this information begins to ripple out, we don't want anyone to be caught off guard once they've taken a training and then they get to this final exciting moment and only to find, oh, there's a background check. So just to be really clear, there is a background check involved, and it's not a deal breaker if something were to show up.
Sarah, we have a quick question in the chat, and it is, do you have to have an Oregon Medical Board MD license prior to training? And Dolores did kind of answer this. Dolores said, no, this is designed for community, so often non-acupuncturists and people with a lived experience become trained as trainers.
Yes, thanks, Dolores. Yay. Definitely. So rewinding, this is not for doctors. Doctors already legally can do this. This is not for acupuncturists. Acupuncturists already legally can do this. This is for everybody else. If you go through this certification and registration process, meaning you go through the training and you follow all the checkpoints thereafter, you, regardless of your education, regardless of anything else, you are able to do this. Just these 5 points, but that's all you need. So hopefully that, is already clarified, but hopefully it clarifies it more. Thanks, Chelsea. So how to stay up to date? Because, it's January and we're excited, but it doesn't truly happen until March. You can always check the Oregon Medical Board's landing page for 5NP. You can check our website, Working Class Acupuncture's website, for the 5MP training offerings. You can check the Polka Cooperative and the NADA websites for other state trainings. And you can also reach out to me directly and see if we can get a pop-up clinic and or training set up at at your palace of work, because everyone's place of work is a palace. So all these links should work in the PDF that Chelsea had sent you earlier this week. But truly, please reach out. This is something that we're just so excited is possible in Oregon. And if you are not in Oregon, please reach out, because we want to give you the roadmap we were able to follow so that perhaps Washington and Idaho and Alaska can do this too. Um, I, I'll proceed to the next slide, but during questions and answers, there are a lot of you on this call, I believe, who have been doing this in your states, and I would love so much if you feel open to it to talk about the hows and the whys. And I'd love for anybody who wants to connect through the chat or verbally by unmuting yourselves, like, let's connect, because we really don't want Oregon to have done all this work for it to fizzle out. We want people getting trained up to be technicians, and we want people to be able to train also. So um, I'm really excited. Okay, yeah, we made it to the evaluation survey. So please don't forget to do the survey at the end as well. But I'd love to open it up for discussion, questions, comments, what have you.
We did get a couple of questions and comments in the chat, so I'm going to go through those, and then whoever else wants to jump in is welcome to. But we did have a question for any connections in Washington for this, and is this allowed in Washington State right now?
Yeah, great, great, great. So this is not allowed in Washington State as per Washington law. I did a little research because I just had this broad assumption that none of the states involved in this except Oregon, and Oregon not until March, it wasn't legal. There was something in 2017 where the nurses board, sorry, I don't have the right languaging, but where it had looked like the nurses had at least taken a first attempt at bringing this in. And as far as I know, it was just an attempt. There is no legal answer to that currently. It is a great place, perhaps, though, to begin. And Dolores, I think you're up in Washington. Do you want to share anything about that?
Yeah, I will say, uh, hi everybody. I'm Dolores Jimerson. I'm one of our community advisors here with Northwest ATTC, and I'm the Behavioral Health Education Director at the Northwest Portland Area Indian Health Board. We serve the 43 tribes of Idaho, Oregon, and Washington. And I will say that we gave comment on the state plan, the behavioral health plan. We recommended 5NP. I do not know what became of that because there were a lot of budgetary issues that got in the way. But we were advocating for tribes to be like we did in Oregon, use your tribal sovereignty to be able to provide this and negotiate for reimbursements from Medicaid. So I know some people might also be interested in that. We did set this up in Oregon. It's your code 97810, if I remember it right. It's always the Pendleton zip code, the last two numbers flipped around. That's the code you use when you're doing your charting. And it's for people who carry that diagnosis, a drug and alcohol diagnosis, or you're doing relapse prevention. And I will say for third party payments, we also had different insurance companies reimburse us when we were doing smoking cessation and when it was accompanying somebody's even diagnosis of depression. So the therapists were using it.
Thank you.
Thank you, Dolores. It's so great to have you here and share your experience. It looks like you've done a ton of work with Yellow Hawk and other tribes around the state of Oregon too. So, if folks have, questions specific to that, Dolores might be a great contact for you. We do have a couple other questions that were thrown in the chat here. One was, what is the outcome research that supports its effectiveness with workforce retention?
Can you say that again?
Yes, of course. What is the outcome research that supports its effectiveness with workforce retention?
Mm. Short answer, I don't know, but long answer. Um, we One of our offsite clinics is at Coda, and I would say we have a really good turnout. We're there 4 days a week, um, and we have a really great turnout. And our turnout isn't just people coming in as participants of the program, but it's also people working there. Um, I think that the the idea that you could have this happening in your workplace on a work day just definitely would offer to workplace retention. You, in my description of when I got the pins put in while I was teaching, I don't want to give the wrong impression that you couldn't then go back to work and do your day. You definitely can. So I think it probably would be really beneficial for workplace retention. And I don't know if Patty's on today, but and I don't want to put you on the spot, so you don't have to say anything, but I think you perhaps have experience working somewhere where you were able to receive treatment while working. I might be wrong.
Yeah, no, I'm here and I was at Coda. a number of years ago. And yes, we encouraged our team to join in. And it was a lovely way to reset for ourselves and also that community connection and walking really literally alongside patients who are getting treatment at the same time.
Thanks for sharing that. Sorry to put you on the spot.
All right, I do have another question in here, Sarah. So it says, I know we can bill for OHP for this as an outpatient SUD treatment center, but can we have a community outreach clinic to other people who have OHP but are not seeing us for SUD diagnosed conditions? Does this require an SUD or mental health diagnosis for reimbursement?
My personal understanding of anything having to do with billing is that there is nothing. So, Dolores, some of the stuff you're talking about, you know far more about that than I do. And if you want to take the mic on this, that would be awesome. No pressure.
That's okay. Philip, I would say it depends on what you negotiated with your contract with Oregon Health Plan. For tribes, it's a little bit different. And we know that that was something we made sure that it was included in our reimbursements, that that would be a covered service. And also what you have developed when we talk about going beyond the four walls. So if you're going beyond your treatment center, you might have traditional health workers, as they're called in Oregon, your peers, your recovery coaches. They could become trained as a 5NP technician. That's where I would see them in community. We call them relatives, some of our 5NP relatives in Michigan set up in a city park. They have the chairs in a circle. You just come and join the circle. So it's, again, you can provide services beyond your four walls. You have to make sure all those codes are in the chart note, for the location. That's the main thing I could think of for that. And we did use it for both SUD and mental health diagnoses. The therapists would be using it in one-on-one sessions. So they would place the needles, have the individual sit there for 10 minutes just receiving treatment. They kept the needles in, then went into their individual therapy session. So when we were doing our chart notes, we would say, that they were there for individual therapy. When you're describing what was provided, it was, whether it was narrative therapy while the 5-needle protocol was in place. And we even had a template designed. You saw that picture that Sarah had with the 5 points. So then we just numbered them where it said received treatment endpoints, it was like 1 through 5. And then we described the outcome, which I will say for everybody, we started saying this is good for what ails you and that your body knows best. I have never seen anybody receive this where they didn't walk away feeling better, whatever better meant for them.
Thank you, Dolores.
Thank you, Dolores.
Yeah, thank
I
you.
am just looking at the chat here. I'm not seeing any other questions. If I missed a question or a comment that you had and you want to share, please feel free to come on chat or to add it to the chat. It looks like Heather says, I thought I read somewhere that 5NP could help with other issues besides mental health and substance use disorder.
So, if you look at the specific language in the law, there were 3 things that we got it passed for. And those are the 3 things we talk about. But 5NP is something that talks to the entire, all systems within the body. And so as someone who practices acupuncture, I could rattle off so many things like diabetes and, just back pain, so much. But what the law is written for is very specific. And so we're walking these lines with how we advertise. But it's a a really powerful resource. If you go to a training, you'll learn quickly that the ear is a homunculus. So you could imagine a fetus where the lobe is the head and and then the spine and the legs. So there's just this entire microcosm right here on two sides of your head, assuming you have both of them. And there are so many benefits, but as per Oregon law, 5MP is for these set things.
And Sarah, looks like Heather is wondering what those three specific things are. Are they mental health, substance use, and then is there a third? Or what is that third? Do you know?
I think we were allowed to say stress. I'll find the law and I can share it out at the end.
Perfect. Thank you. All right, folks, any other questions or comments? Or I know Sarah had mentioned, maybe helping to provide contacts or supports if you're looking to do this for your own state. So if anybody wants to chat about that, now would be a great time too.
Yeah. Are most of the people here from Oregon?
I think a lot of us are, but I think we have a lot of folks from Washington as well.
Okay.
I think we have folks from all across the region in here today.
Okay. Yeah. So those of you who are in Oregon, whether you're someone who's already been utilizing this on tribal land or if you are somebody who is very excited to be using this, please, please, please reach out. We're hoping to do a really big ripple out across the state and make sure that every county gets involved that isn't, I imagine every county in some way is, but we really want to get this out there. If you're in Washington, and you're curious about stuff, you can reach out to all ears, one word, at polkacoop.org. That will get you to the people who've been tracking legislative movements in Washington. I was checking in with them a little bit about this in advance. And we worked also really closely with Chuck Pyle, who is a retired judge who does 5MP down in Arizona. He's a great resource too. And so if people want to reach out and kind of find out like, where has this already tried to move? Where did it lose traction, gain traction? And definitely Dolores. Um, and then with Idaho, I know something started and then it just kind of hit a wall. I was trying to get a little more research on that in advance of this too, and I don't know more than that, but I know people are excited. So I think the first step for any other state that's trying to pass this is find some people who are excited too. And then definitely you can reach out to me and I can connect you with Chuck or with Will or with people at Polka who can kind of get you towards that next grasping point. But to make this happen, you're going to need to begin building relationships with your version of the Acupuncture Association. For us, it's the Oregon Acupuncture Association. You're going to want to kind of find out which representatives in your state government might be sitting on the health committee or find a committee, someone on that committee who might be open to championing this with you. And really just don't be shy about asking people, what step did you take next? Because everybody who's been walking on this path wants this in every state. So even if they don't get back to you right away, everyone's doing 7 other things at once, but there's probably a great connection for you out there, if not already on this call.
It looks like Kimberly is wondering if you can add a contact for Washington. You mentioned all ears, but I think maybe we're looking for the full name. If you can add that to the chat.
Oh, let me see if I can chat. Um, I have so much trouble with this. It's all ears at Polka Co-op, POCACOOP.org. That is going to connect you with someone in Rhode Island, but they are the ones who've been tracking states that have taken running starts at this. I don't have a specific connection directly in Washington myself.
Perfect. Thank you, Sarah.
Yeah.
And Julie commented, she said she utilizes AccuDetox at Yellow Hawk Tribal Health Center. Also, will you be sending out information concerning when a POCA 5NP training will be occurring?
Yes. So if you're already doing this, awesome. And we on the Working Class Acupuncture website have within it a sub toolbar click for 5NP. The minute we have trainings, we're going to be posting them there. I can definitely reach out to anybody who wants to share their information and get you on our Google form list, or you can get on it on the website actually. We were waiting appropriately and politely and patiently until it's March, or until the Oregon Medical Board says, yes, this is true. Like, you can start posting stuff. But if you're already doing it, you don't need to go to a training. You probably already went to one. So you're just going to need to get registered with the Oregon Medical Board. It's a 3-step process of go to a training, get your certificate from that training, and then register with the Oregon Medical Board. So sounds like you've already gone to a training, which means you probably already have a certificate. I may be wrong, but that's what it sounds like.
Sarah, this is Julie Coy is Julie Brandenburg. I sent the email. I
That's
forgot
what
Julie.
I thought.
I forgot she got married and her name changed. I'm sorry.
That's what I thought. Okay, so you want to be a trainer. Is this what we're talking about, Julie?
So yeah, I mean, that would be wonderful. And I don't mind getting, I mean, I know I've been trained and I've been doing this. God, Dolores, how long have we been doing this? 2018?
Yep.
So 2018 we started, and yeah, I've been doing it for a while, and I use it. And I mean, just to be really truthful and upfront with you guys, it's sometimes with billing, OHP can be a little persnickety, or it's just the way the wording is. So it is all about the diagnosing code is how the billers look at it. So I have to be more gentle with my verbiage. Even though, like, even if somebody, if it's for relapse prevention, since at the time when I was doing it, I now currently am a CDACR, so I don't know how that changes it, but it can. You know what, if it's not billable, but I'm lucky because I mainly see, like, most people are travel members. And so that monies is going to be paid somehow. Additionally, outside insurances, private insurance, I have clients that is a billable service. AccuDetox, they accept it in Oregon. So to me, that works. I just know it's an amazing way of healing for non-talk therapy. It's another tool in our toolbox that we can utilize, and anybody can do it. I'm a believer. I think that yeah, people get too wound up in all the theoretical stuff of people just trying to survive life on an everyday basis. So and that's all great, but yeah, I just know that and because I don't want to badmouth any agencies, but it's not. I haven't had in the last over a year trying to get a hold of, or a year plus getting hold of the other agency that I got my credentialing through for anything. I have sent them documents. I'd sent them a new driver's license to prove that I was, 67 years old. So I mean, it was just, but I never heard back. I have never heard anything about updating any of my, like keeping up on my monies that I owe them. Well, if you're not going to stay in touch with me, I don't know how you want my money. So for me, I don't know if it's just needing for my own clarification to ensure I'm fine if I need to come and be observed in the 5NP through POCA, so that then I can have the certification that says that. I'm great with that. I mean, yeah. I don't know. Dolores was my continued mentor, mine and Winona Scott, who's another amazing, and she is a tribal member. So, good stuff can happen with this. So I'm just like, when Dolores told me, and, I've been so busy just being a therapist that it's been really hard to do anything else except for keep my head above water. Yeah, but I'm excited. In fact, next Wednesday on my birthday, we are actually doing a open community event for community members, for everybody to come and get AccuDetox provided. So for a couple hours, I think like from 2 to 4:30. So yeah. And that's how I like it to be done anyway. People just come and go as they can and they need, and you're right. I think it is all about the room. It is definitely all about the room and how you can feel the energy in the room. Yeah. So yeah, I'm looking forward to it. So I think it would be great. I would love to come and down and just, if it's just 2 days, I'll figure it out. Like if it's on a weekend, whatever, that's good. If you do it during a week, I'll, do that as well.
But Sarah, I think Julie brings up a great question. What if you already have your NADA ADS? I think that's the question. Do you have to do additional stuff to
right.
register?
Yeah. Thanks, Dolores.
Yeah, thank you. Thank you both. Yes, I hear that question and I was excited to hear it because you don't have to do very much at all. POCA recognizes that NADA, you know, it's the same or is similar enough. So, if you write to all ears at pocacoop.org and say, "Hey, I'm me. This is what I've been up to. This is who I went through my training with, and I'd love to become certified with POCA."
Okay.
I think they're gonna have you pay $50. It's a one-time fee with them.
Okay.
And they'll have like a orientation Zoom probably. And if you and other people that you know in the same boat want to just do a group email and they take care of everybody, hopefully in one Zoom. My understanding is that you then have the equivalent POCA certification, then $50. That's it. If then you wanted to become a trainer because you've been doing it so long, that's when you and I would want to connect. And that's when you then need to come do some co-trainings. It doesn't cost you anything except missing work yourself, but and travel. But yeah, if you just want to become a POCA technician on paper, all ears call at pocacoop.org is the way to go.
Okay, that would be great. Oh no, and I would love to become, officially, be able to provide the training.
Totally. That would be wonderful.
And I really believe, we'll see. I'm not going to speak for Winona, but she's as a tribal member, I think it's important to see if that's where she wants to fall into. So yes, Dolores. So
Yeah.
Yeah.
One of the main things that this Oregon law was hoping to do is to start getting people who've been doing it on tribal lands now to be
Mhm.
trainers and ripple it out
Yeah,
further. Like that's,
absolutely.
you know,
Absolutely.
so
Yeah.
let's make it so.
I just want it that way, yeah, because everybody's just so like, ooh, you have to like, and you're just like, oh my God, people.
Yeah, come March. Woo!
It's the same battle that we've been having between the mental health, and A&D, like, dear God, don't step on my toes and don't do this because you don't know how to do that. And I'm just, you're like,
Yeah.
whatever, man, it takes both, doesn't it?
Yeah.
It's just
Right.
like, come on. So
Yeah.
let's just do one more thing that is going to help the healing of people's,
Absolutely. And
because we
just
need it. We need
yeah.
it.
And the idea of billing insurance and this and that, I'm not
Yeah.
very familiar with it, but what I am familiar with is that a box of 1,000 needles costs anywhere between 23 and $26, depending on which kind you buy.
Yeah. Oh, yeah. Lost you, Sarah. So, yeah. Anyway, Sarah, I don't know if you can hear me, and I totally agree. So, I think we're better off that way. And
Box.
Dolores, you're off.
Oh,
So, I think, yeah. And Sarah, I see Dolores sent me about doing a trading. Okay. Okay. All right. Yeah. Just sending me stuff. So, but yeah, I want when you get ready to do that, I would love to come and do that. And then I'm gonna have to bow out. I have a client, so I'm gonna go use the little girl's room before I don't get a chance again.
well, thanks for being here and happy birthday this week.
Oh, thank you. Thank you. Thank you. Yeah. I'll be 68.
Woo!
Yeah. Yeah. Just rocking it.
Yeah.
Got to keep your brains going. Yeah.
Yeah.
So anybody and everybody, thank you so much. And Dolores Jimerson, as usual, you're an amazing share of information and getting people to work together and spreading the word for all of us to connect and stay connected. So yeah, I gotta go. Take care, everybody.
You
And
Bye,
too.
Julie. Thanks for
I'll do the
coming.
ending survey here. It's on my phone, so I'll do it here in a little bit.
Sounds perfect. No
Okay.
rush.
All right. Thanks, guys.
Thank
Take
you.
care.
Thank
Okay.
you.
Bye.
All right, everybody, we have a couple minutes left, so I just want to ask any last minute questions for Sarah here. Anything else you guys want to touch on? Any contacts you're looking for? I didn't see any more questions in the chat. Not hearing anything.
I had a quick question.
Yeah, go ahead, Heather.
Um, I'll turn my, I'm trying to turn my video on. It's taking a minute. Um, but I had a question about um, once you learn how to do this and you've received the training, so I come from a chemical dependency and a social work background, so I might use some terms that relate to that because that's what I know. Um, are there practicums or training hours before you're actually certified?
Great question. We have it baked in. So there is a required 30 hours of didactic training.
Hmm.
Some of that happens in the hybrid version, a lot of that learning happens online pre and post module. But you are in person for what we call a weekend training, though it might just be 2 days during the week. But
Okay.
there's a presentation that happens during those 2 days, but the majority of what you're doing is you are learning your fingers. Like your hands are
Okay.
learning how to do this thing. Um, you have to have completed 40 years in order to get certified, and you take a ethics pledge and you take a final test. It's open book, don't worry. But the 40 years means one, two, not like one person, two people.
Okay.
And by the time you have needled these 5 points in 40 ears, historically, it has proven that you are pretty safe to sail.
Okay.
Those 40 years should happen in that weekend. In the event they don't, there's always additional clinics
Okay.
set up so that you end
Great.
successfully.
After you complete the training, are you able to have some kind of professional designation that you know how to do this after your name, just as we would if we were social workers or chemical dependency professionals?
You are a 5NP technician in the state of Oregon.
Okay. And so we can put that at the end of our name once we obtain?
If you're registered, yeah,
Yeah, yeah. Okay.
I
And then
believe.
my last question is, are there then official volunteer opportunities that we could sign up for to give back to our community once we've learned how?
That is
Is
such a great question. Um, Depending on where you are and what you're near, my hope is that we'll all know a lot more about each other by then and know who's looking for something like that. But once you're a 5MP tech, that's something you can offer as a volunteer. You can, I don't know where you work or what you're near,
so
but
I'm in Portland and
oh, great.
I'm a student and so I'm not working yet. So I would like to add this as a volunteer opportunity.
Yeah, so if you wanted to say, I have Wednesdays from 4 to 6 available for me to
Right.
do me stuff. I want to talk to the church down the street and see if I can utilize their space and just not charge people to come in and do this. You can get really creative, and we'll talk about that in trainings of what a
Okay.
5MP clinic even looks like.
And
Um,
could we join the existing clinics that you're talking about where people are doing this to groups of people already in the community? Could we sign up to be a participant there?
so you couldn't sign up at Coda per se because we're just an
Okay.
outside partner coming in.
Okay.
But you could reach out to Coda probably. But the clinics I work at are actually full body community acupuncture
Ah,
clinics.
okay.
But you could potentially, after a training be like, hey, I noticed that your clinic isn't open in the evenings on this day. Could I use the chairs? Could I do this offering? And,
Got it.
we'd go through that process. But the way Oregon's working with it legally is every single time you treat 5NP, you have someone fill out the consent paper, and that's it. But you got to do it every time. You got to hold on to it for 3 years. So where and how you take this into your community is really pretty flexible.
Okay. Thank you.
Yeah. Thanks for your interest.
All right, and we're just about at time, but we have one more quick question in the chat for you. Are they recliners? I think they're referring to the chairs that you mentioned.
If you go to a working class acupuncture clinic, they are recliners. If you go to Coda or if you go to most of the ones that like we were doing pop-ups at the Capitol to get this going, they were just standard straight back chairs. Um, it's whatever you got. You work with what you got. We just happen to have recliners at our clinics because we do full body. So we do have people recline.
Perfect. Thank you, Sarah. All right, and we're just about at time, but I want to thank you all so, so much for all your contributions today. And thank you so much, Sarah, for being here with us and preparing this and sharing. And thank you for Dolores for sharing all your expertise with us today, too. And thank you all for just being so participatory and involved. And we just appreciate you. So I hope you all have a really great day. And just a reminder, this is recorded and we'll have it up on our website in about 2 weeks or so. So you'll be able to access it there and share with others. And then, like Sarah mentioned, keep an eye out for March. It sounds like March is going to be a big month for this. So keep an eye out for more information, and that'll be coming soon. But thank you all, and I hope you have a really, really great afternoon.
Yeah, thank you so much.
Bye, everybody.